Welcome to Periop Talk, where we discuss the important current surgical topics and education for you to take back to your OR. Together, we're making surgery safer, one podcast at a time.
Well, hello, everyone, and welcome to AORN's Periop Talk Podcast. For those of you that don't know me, I'm Hannah Campbell, Program Manager for AORN Center of Excellence in Surgical Safety Award Programs. Since launching these programs first ever in 2016, these programs support hundreds of hospitals and thousands of perioperative professionals worldwide in advancing patient safety and surgical excellence. Today, we are talking about our newest award program launching on Monday, October 6th, Enhanced Recovery After Surgery, also known as ERAS. In this episode, we're going to be diving into the Center of Excellence ERAS Award Program, what it is, why it matters, and how facilities can get started. And I'm very happy to be joined today by Dr. Lisa Spruce, AORN Senior Director of Evidence-Based Perioperative Practice and author of the AORN Guideline for the implementation of enhanced recovery after surgery. So obviously, Lisa brings a deep clinical insight into this topic and a passion for evidence-based practice, and she's here to help us unpack how ERAS protocols are transforming perioperative care, especially with this program in place. And then also how a facility can be recognized for leading the way implementing ERAS. So whether you're just starting your journey to ERAS or exploring how to earn the ERAS award from AORN, this conversation is definitely for you. So thank you so much for joining us, Dr. Spruce. Welcome to the podcast. And I'd love to hear more about your role at AORN and your experiences with ERAS and how that inspired you to develop this program.
Well, thank you so much. Thanks for having me. It's great to be here. ERAS is definitely a passion of mine. And my role at AORN, though, is I direct the team of nurses that write our guidelines. And this was a guideline that I was going to, I just become very passionate about it. I'm going to do it. So what happened, though, was I actually was a patient in a couple of years ago, and I had to have shoulder surgery. And I was in a small, 3-room outpatient surgery center, and they had an ERAS program. And I was so impressed by the way they treated me, the recovery process, and all of the things that they had in place that really just looked after my recovery and pain and how I was going to do after surgery. And that was such an inspiration for me. And I'm like, okay, this, and I think my notion and my preconceived idea of ERAS was, okay, well, that's only for these big surgeries that are, just really lots of complexities to them. But that's not true. ERAS can be implemented with every patient. It doesn't matter what type of surgery you're having. And so I was like, I'm going to write a guideline on how to implement ERAS with every patient. And that's what I did. And also after I started doing that, I heard the same thing from other nurses, like they wanted to implement it too. And they were excited about bringing this standard of care to their patients. And so that's sort of how it got started. And then, we are really in an era of we are moving towards value-based care, where improving patient outcomes and reducing costs is what we really need to do. It's essential. And ERAS aligns perfectly with that shift. It's evidence-based, it's patient-centered, it's proven to enhance recovery while lowering complications and hospital stays. And so that was another reason, like, okay, let's do this. This is really important. And then after we wrote the guideline, we saw an opportunity to create the Center of Excellence program around ERAS as a way to recognize those facilities that do put excellence first and that are working in a culture of continuous improvement. And so it just elevates nursing's role to support team collaboration. It helps facilitates facilities to achieve measurable improvements in care. And that is so, so important. And so with your help, as you know, we have getting ready to kick off this program, and we couldn't be more thrilled.
You're so right. That's one of my favorite things about this program compared to so many other initiatives that we offer is it involves so many people outside of the OR to support patient care. And I think the more aligned every team member is, the stronger they're going to be as a team as a whole. So I really appreciate that aspect of it. And it also gives us a chance to work with, several industry partners, which we'll talk about who's involved and how our hospitals can be supported throughout the program with our industry partners. So a lot of people listening, Lisa, as you know, may not be familiar with ERAS. Can you put it into simple layman terms for us? And you talked a little bit about patient outcomes and its importance, but just kind of dumbing it down a little bit more for us non-nurses.
Okay. Well, this one is so highly evidence-based. There's so much research around the program, around the protocols, so we can be confident that what we're saying is very much supported in the literature. But the protocols are designed to improve patients' physical and psychological conditions before, during, and after surgery, because we undergo a lot of stress. Your body goes under a lot of stress during surgery, and so these actions are tailored to address that stress. The protocols involve the entire perioperative team in a coordinated plan tailored to each patient to enhance their outcomes and really speed up their recovery. But really, just simply, it uses proven steps to get patients ready before surgery, take care of them during it, and help them recover afterwards. Everyone on the team, doctors, nurses, and others, works together on a plan that fits each patient's needs, and the goal is to make recovery quicker and easier.
I love that. That definitely helps me to understand as a non-clinician. And I think that's also a really neat part of this program is it also involves the patient, which, having reviewed some of the program materials, since I get a sneak peek at all of these things before they go live, I love that. I love that the patient is also involved in their own care and kind of becoming the advocate and learning about what's going on. Having had surgery a couple of times myself and not having an ERAS program, I'm like, wow, this would have been really great to know beforehand. With that, what are some common challenges that facilities may face when trying to implement an ERAS program? And do you have any, advice to overcome that?
Yes, absolutely. And this was addressed in the guideline. So there's a lot of information in the guideline to help with the implementation piece, which sometimes is the biggest challenge because facilities, they struggle with inconsistent practices across departments. And if you think about that, you want all your patients to have the same standard of care. So inconsistency is not good. And then there's sometimes a lack of interdisciplinary collaboration. There's resistance to change. And there can be gaps in education and data tracking. So this award program addresses these challenges. We offer a structured evidence-based framework that brings that entire perioperative team together. We provide tools for standardizing care, training staff, and measuring outcomes, making implementation smooth and more sustainable. But we do realize that implementation is a big challenge, which is why the guideline is titled Implementation of ERAS. And we do include the things that facilities can do to implement. And then the COE just adds so much more to that.
Absolutely. It's basically the step-by-step guide, right, of what you learn in those guidelines. Yeah. You're basically getting a handbook of how do I make this guideline come to life in my team?
That's exactly right.
It's really cool. Well, that kind of answers the next question, but I'm sure you have more to add. I'd love to know how you think this program in particular differs from other ERAS trainings that we've seen that are available.
Well, I think it's really, our program is really a step above. It's alignment with AORN's trusted standards for surgical safety. It aligns with our guideline, which is evidence-based. And while many ERAS resources are physician-led or focus heavily on anesthesia and surgical techniques, our program emphasizes the critical role of the interdisciplinary teamwork within perioperative teams. And I think that's really important. It's also the only program that leads to a Center of Excellence designation. Like, you get recognized for meeting the highest standards in ERAS implementation. And what a beautiful way to let your patients know that you are a culture of safety and that you are putting them into the highest standard of care that they can get. I mean, that's amazing. And that's why we did it.
Oh yeah, 100%. Couldn't agree. I'd personally like to know the place I'm going to get surgery has the AORN's guidelines back.
Same.
That's something I look for now.
Yes.
Well, we talked about how the guideline is basically what backs and supports this program. Are there key learning components and tools within the program that facilities get access to that you can talk about?
Yes. Oh, they get so many resources in this program. It's fabulous. So they get step-by-step directions for building and sustaining the program, role-specific education for nurses, surgeons, anesthesiologists, and other team members, implementation toolkits, checklists, templates, benchmarking tools to track progress and outcomes, and guidance and support from our team if they need it. The other thing I think that we give them that's so important is the business case. Like, how does this support cost saving in your hospitals and your facilities? So that's also a great resource for them.
That's a great mention and call out there, because I think a lot of hospitals who want to implement programs and new initiatives within their teams are like, what's the first step? How do I get leadership buy-in? And that business case that you mentioned is available to program participants. It's basically, it's a leave behind. You don't even have to do the work. That document really does the work for you and says, this is important. Here's all the benefits that you'll get, not only for your patients and team, but that cost analysis piece, which we know is very important to leadership teams at the C-suite level.
Yeah.
So great mention there. What measurable impact do you hope to see for our patients and surgical teams to achieve this award?
Oh, I think there's going to be a lot. So once people have received this designation, it's really a powerful milestone for them that reflects meaningful, measurable improvements across the board. So we couldn't ask for more than that. And for patients, we expect faster recovery times, higher satisfaction with their surgical experience, like I experienced such a difference, fewer complications, lower readmission rates, leading to better overall outcomes, and a more personalized and supportive healthcare journey. And for facilities and teams, the impact, like we said, includes reduced cost. And that's usually tied to shorter hospital stays, fewer readmissions, fewer complications after surgery, and then recognition at both the community and national level as a leader in surgical safety, a more collaborative work environment where interdisciplinary teams are aligned, they're engaged with each other, reduced workload for staff through streamlined, standardized processes. And honestly, there were studies that showed how an ERAS program decreased workload, which was great. So that you can see that study in the guideline. And then greater consistency in care delivery and improved team communication. So there are a lot of benefits.
Goodness gracious, that is a long list of benefits to everyone involved, patients and teams alike. I don't think I've ever seen a benefits list that long.
I know.
Who doesn't want that,
Yeah.
And I think with as much work as our nursing teams are being, getting put on them every single day, this is such a great thing to streamline that work and take some of that load off of them,
Exactly. Yes.
It's really great. How does this program and ERAS in general tie into AORN's broader mission? I know you and our team, we understand that we don't do anything that doesn't align with our mission. So can you speak a little bit about that?
Yeah, absolutely. It is a natural extension of AORN's mission. It promotes evidence-based practice. Number one, very important, and interdisciplinary collaboration and patient-centered care. These are all core values that AORN has. And by helping facilities implement ERAS, we're advancing safer surgery and better outcomes, and also empowering perioperative professionals to lead change in their organization. Be that change leader in your organization is so important.
Yeah, absolutely. And I think our members and just everybody listening, you don't even have to be a member to take part of this program.
That's right.
But just knowing that this is at the core of AORN's mission. So, doing what's right for your team, this is just what that means, essentially. And you talk about your last sentence there was just talking about be that leader, of change at your facility, which can be intimidating. Do you, what would you say to a perioperative leader who is considering bringing this program to their team? What do they do?
I think simply it starts with a conversation and get your teams together and talk about it. You don't have to have everything figured out. It's just a commitment to improving surgical care. That's where you start. And our program is designed to guide you through each step with expert support and proven tools. And the benefits for your patients and your team are real and measurable. Taking that first step could be the beginning of a transformative journey for your facility.
Couldn't have said it better. It really is. And if you don't know how to start that conversation, use that business case. We've got resources to support you, because we know a lot of listeners want to make changes, but maybe just don't have the resources to support that. So we're here to help. We are absolutely at your disposal. We want this initiative to be expandable and easy for you to implement. So, if there's something that you see is missing, that's something we want to hear too. Although I think there's more than enough resources that are going to support you in having those conversations.
Yeah.
I just cannot thank you enough, Dr. Spruce, for coming on this podcast, sharing your expertise, especially as the author of this really important guideline. It's just so helpful for our listeners, I think, to hear it straight from the expert. So how does a facility get enrolled? Where do they go?
Oh, so simple. Just go to AORN's website. It's free to participate in with the program. You don't have to be an AORN member to enroll. We talked about that. So just go there and it will walk you through it step by step on how to do it. And also, I think, Hannah, you're a great resources for our hospitals, and we're happy to have conversations with hospitals. We're happy to have calls. We're happy to have one-on-one, whatever meetings to help them if they need it.
Absolutely. She's right. Yeah, Lisa and I are always available. We get on calls all the time with hospitals who want additional support. So reach out to us. We're always here as the experts of the program and of the guidelines. Use us to support those conversations. And we can't mention this enough, but this program, as Dr. Spruce has talked about, is interdisciplinary, which means it involves every piece of the surgical team. So pre-op, during the operation, and post-op, which also means that we work with various industry partners who can support different areas throughout the surgical continuum, if you will. So thanks to our program sponsors, ConMed, Pacira, and Solventum, for making this program available and free to anyone who wants to participate and learn about these guidelines. Thank you so much. Their support really does just make it all possible for teams to take action, protect staff and patients, and lead the way in surgical safety. So thank you again, Dr. Spruce, for joining us. Thanks to all of our listeners for tuning in, and we'll see you next time.
We hope you enjoyed this episode of Periop Talk. Be sure to like, comment, and subscribe so you never miss an update. And join the conversation with us on Instagram at AORNPics, or follow along on Facebook and LinkedIn. Looking for more perioperative resources? Visit AORN.org for everything you need, including clinical resources and educational tools. Thanks for listening.